created 3 months ago to address the impact of COVID-19 on the BAME communities and patients across the Black Country. I have been engaging with a range of voluntary and community organisations to understand how their communities have been affected, addressing the barriers that they continue to face and looking at what support mechanisms may be needed to support these vulnerable communities. As a BAME COVID-19 community development worker, I work as part of the Equality and Diversity team within the Black Country NHS. I would now like to introduce you to Paul Singh, the Equality and Inclusion Lead, to open the event. Over to you, Paul. Thank you.
Thank you, Nazim, and good morning, everybody. It's good to see so many of you here today with us. So thank you for joining. I've just been asked to set the scene. So my name is Paul Singh. I'm the Equality and Diversity Lead. The next slide, please. I've been asked to kind of set the scene, which I will be. But as you know, that the aim of today's session is to hear from yourselves, the communities, in terms of the impact that COVID has had. I'm the Quality and Inclusion Lead, and we've got Yasser, my colleague, who's also part of the team, and I'm proud that the CDWs have been appointed through the SDP and the CCGs. But what I wanted to say is just just a kind of bit of background of our trust. So we're Black Country Healthcare NHS Foundation Trust. We've been formed as of the 1st of April, again, challenging times through COVID and the lockdown. And we've taken over two kind of legacy organisations, Dudley and Walsall Mental Health Trust and Black Country Partnership Trust. So we are now the main mental health and learning disabilities provider in the Black Country. We've got around 3,250 staff, a total of 65 sites, 7 acute hospitals, 58 community bases, and we serve a population of 1.16 across the Black Country. And we cover 4 boroughs: Dudley, Sandwell, Walsall, Wolverhampton. Next slide, please. As you can see, here our vision and values, been a new organisation, but these values have come from our workforce. And you'll see that caring, enabling, working together, integrity is our vision and values, and we live these vision and values. And I must admit, these have been tried and tested through the pandemic and these difficult and challenging times. But I'm pleased to say we have been working with integrity, working together with our patients and staff, our communities, enabling and supporting each other, and doing what we do best is caring for the populations that we serve. And equality and inclusion is a golden thread throughout the organisation to eliminate inequalities and discrimination, but also to make sure that we foster good relationships across our communities and challenge work around the disproportionality of BAME communities, our workforce, frontline workforce, a lot around risk assessments, protecting our staff, and also working with our communities and our STP, which I'm pleased through the CCGs have kind of funded the CDWs that Nazim has just kind of introduced. The next slide, please. So this slide, I just really sets the scene of what you're going to hear from voluntary sector, community sector. You're going to hear a lot of lived experience and the challenges that the impact of COVID has had. So you'll see in terms of communities, the impact it's had on communities, the new norm, we keep hearing that new norm, the new ways of working, living, the impact it's had on families, carers, children, and the important impact of the role of communities, of the role that they played to support and the most vulnerable in the communities, and the issues around impact of workforce discriminated against. Why is it COVID having more of an impact on BAME communities? Why is the issue of systemic racism that's still happening? So there's a lot of challenges, and like I said earlier, we're doing a lot of work around this, and the impact and the roles of faith communities. And we've seen that some of the rituals, some of the issues around bereavement, and couldn't take place because of the restrictions and things like that. So again, I don't want to steal the thunder of the communities or the limelight. It's just I thought I set the scene in terms of the community, the impact that COVID has had. So thank you very much. Enjoy the webinar, and thank you again for joining us. Thank you very much.
Thank you very much, Paul. That was really interesting. So the next slide, please, James. In terms of the overview of the session today, so the plan will be that we'll be hearing from a range of voluntary organisations across the Black Country on their experiences during lockdown, including the barriers that they faced and how their service is adapted. On the second half of this session, we shall discuss the barriers and the current challenges that BAME are facing. So I'm hoping to hear from different voluntary organisations about their experiences. We'll also be discussing around the access to PPE in terms of, and also the risk assessments, as well as the impact of the second wave and the new normal. Thank you. So I would now like to introduce you to our next speaker, Shaz Akhtar from Transforming Communities Together, who has amazing links within the communities, and her role as a Black Country Near Neighbours Coordinator. Okay, over to you, Shaz.
Thank you, Nazima, for that introduction. So today I've been asked to talk about the barriers that exist in Black, Asian and minority ethnic communities and how they have surfaced and how Black Country Near Neighbours has continued to work with organisations and residents during the pandemic. So in the beginning of the lockdown, a lot of people struggled with the idea of staying home, and we saw people reacting to this in different ways. I remember the supermarket shelves and how empty they were. Myself and neighbours chose to focus our time in our gardens and improve our homes. But we also had residents adjacent to where I live who resided in high-rise flats, and they did not have any open space like us to distract themselves. So when I was thinking about today's webinar, the slogan, "We are in it together," it kept on resurfacing in my mind, and I questioned and I kept on reflecting upon it. And the more I reflected, the more I questioned whether we really were in it together. The pandemic has highlighted the inequalities in general within our BAME communities. When talking to residents and grassroots organisations, I have observed that this is largely down to social and economical barriers that these communities face. So when I say social and economical barriers, I'm referring to, by and large, BAME communities. They live in highly dense and deprived areas, in poor social housing, they are working class, have more basic amenities, and more likely to be on zero-hour contracts, not sure how they will make the ends meet at the end of the week, and some are more highly reliant on food banks. Now, these are just a few barriers I've mentioned, but just listing them like that verbally is stressing me out. Can you imagine what a huge impact this can have on a resident's mental health and well-being? Now, my role also involves me working closely with faith organisations, and I am one who will turn to faith in times of anxiety and despair. Residents expressed how they couldn't fully use their facilities of the places of worship, and not being able to had an impact on their mental health, anxieties, and they felt really isolated. And I think what further added to these anxieties were far-right groups using faith to point the finger of blame for the spread of the virus. We saw racist graffiti targeting a Chinese takeaway, and across the Black country, more and more residents told me about the verbal abuse they were encountering. All this surely has an impact on one's health. Now, I can endlessly talk about the barriers communities are facing, but how can we break down these barriers? Whether it's a grassroots community issue, it could be in health inequality and inequality in general. I do strongly believe with the role, especially with the role that I deliver, it comes down to a collective approach, organisations working in unity and moving together hand in hand. But I've only been given 5 minutes, unfortunately. So now I will touch on how near neighbours have been continuing to create spaces. Now, a few weeks into the lockdown, my aim was to talk to as many residents and leaders of organisations and find out how people were coping, what would make them feel a bit better. But after a successful reunion on a Zoom conversation online, I was optimistic this could work with a lot of groups, and I wanted to move those groups online so they could have a bit of normality in their lives. Now, I knew this would come with its challenges. For example, not everyone would be able to download the Zoom app. That's a barrier in itself for some people. So we decided to help people download the apps, and organisation leads help their service users where it was needed. Now, from the popularity of these groups, TCT secured some funding to bring people together online. And I will leave the link of this on the chat app now, so you can all find further information because I'm really limited with time today. But to start wrapping up, all the health inequalities stem from something. And as mentioned, our surroundings, our experiences of life, and from what I have observed, BAME communities are at a higher risk because they do face racism in the streets. They live in highly dense and deprived areas. The housing conditions are poor, and the list is endless. But looking at these points makes you realise our inequalities exist at grassroots levels, and they have an effect in other areas. And unfortunately, on the top of the list, with no doubt, is our health and well-being of our BAME communities. But on a final note, from this BAME engagement, once a report is commissioned, I would really like to see the Sustainability and Transformation Partnership to consider having a grassroots voice present by bringing together voluntary organisations to see how we can move forward to a better future together and make change that will be felt in the grassroots level. Thank you for listening.
Thank you, Shaz, for sharing your observation across the Black Country. I would now like to introduce you to our next speaker, Bally Barker, a former nurse having experienced mental health herself. She is passionate about raising awareness of mental health in Asian communities and has set up the Sandwell Asian Mental Health Support Group. During lockdown, she has supported others and wants to share her experiences. Over to you, Bally.
Survivor. I'm a mental health survivor. As a result of bullying, I became a fighter. I did the time, but didn't do the crime. Through isolation, I became stuck in time. Unable to sleep, my mind went into overtime. Step by step, my journey began as I took hold of my life's master plan. The door opened a new opportunity. I had returned back into my community. Stand up to bullying at work and get support from your networks. Through determination, we can eradicate bullying discrimination.
Thank you for sharing your personal story, Bally, and what an inspiration. Now I would like to introduce you to Irfan Zaman, a project coordinator for One Walsall, One Palfrey Big Local, to discuss how the BAME communities in Walsall have been impacted.
Thank you for that introduction. I just want to cover just a few points really around how BAME communities were affected, but this relates to general communities as well. So with the death rate going higher and higher week on end, the fears for some people were these numbers are increasing. But what we really got to realize when we start engaging our communities is these are not numbers, these are lives, these are people's lives that have been affected, and it's having an enormous impact on the communities. Communities who used to come together for funerals, for condolences, for closure, they weren't able to do that. And if there was a funeral from a family member in Scotland, people would go from Walsall, they were just not able to do that. And the impact of that on those families and on the ones families who've had someone pass away as well was very difficult because neither did they get the comfort and the support they needed. So in our communities, we realized when we were engaging with our communities, the financial difficulties, the access to food vouchers, even when government gave food vouchers to children, people didn't know how to access that. How do we access that? And there's a massive concern in Palfrey about digital exclusion. And sending vouchers out online was very difficult. So the schools really changed the way they worked and made sure those vouchers were available, printed copies to give to those children. It was a very difficult time for parents. At one point, they were so concerned, will we be able to give our children a good meal every day? And in this current climate, in this day and age, that shouldn't be a fear for parents. Risk of jobs, those who'd been in jobs so long suddenly found that they thought they'd be retiring and they weren't retiring in that job. They were at risk. Some people lost their jobs. People didn't know how to put CVs together. They hadn't done one for so many years. And they were thinking, oh my God, what to do? How do I do this CV? Again, seeing your partner more often sometimes isn't the best thing, but it's been difficult for some families because domestic violence has increased, physical harm, mental harm, financial difficulties, and all of that together during lockdown. You're not able to escape, you're not able to talk to your GP. GPs were doing online appointments, which is very difficult for someone suffering DV because how do they talk about that to their GP with the perpetrator in the next room? So we did feed that back to our GPs that this is a very difficult time for people and they want to share and they can't. We referred so many people to mental health services, unbelievable. Domestic violence. Then comes to the fears of schools. In June, parents want to send the kids back because they want them to have a fantastic education and achieve. But they had the fear that we don't know. Some felt the government hadn't got it right, so what do? We can't send our kids back because we love them too much, we don't want something to happen to them. But then they started thinking about sending them back, and then there was a threat of fines. Now, obviously, that's forcing the parents to send their kids back. So the mental health impact of that, do we send them back and get fined? Do we send them back or do we not and get fined? All these things were going on, very difficult time. Then people are thinking, illnesses like cancer come to your house. They take one person and then there's a silent patient, those who are looking after the loved one. But with this, it could take out all the adults. What do we do in terms of wills? How do we support our family? Both adults die. All of this stuff was going around in their heads, and they were finding it really difficult in terms of their mental health, thinking, what do we do? Where do we go? So some went online, but difficulty for our residents was they couldn't access those things online. Although I have to make a really quick point, is the faith institutions really turned around and supported really quick. Literally, in a few days' time, they're all up and running and supporting, which is fantastic. Two final points I'd like to touch on. What we did was we put out a grant scheme to support organisations to serve our residents. So we made sure that things like CVs, food banks and support like that was available, and we invested in that. We supported that to make sure that's happening and it's got the resources it needed. We also gave out packs for adults and children to make sure they've got something to occupy themselves. In terms of learning, there's 2 points I'd like to cover. One is we have to remember there's been communities in lockdown in our communities for way before COVID, and it's come to the forefront how we support them. Secondly, a lot of people were looking forward to coming out of lockdown, but there's communities that when they went into lockdown, they found it difficult, but they found it very difficult. Now, how do we go back into the community, into their mental health? How do we try and live a normal life out there after being in the house for 3 months? It was a very difficult time for some people to literally cope to even get out of the house. And the final point is around PPE and support for community faith groups. We had support for community faith groups in terms of risk assessments and stuff, but we feel it came very late. That support should have been there before they opened, had the right risk assessments in place, the right support in place. And secondly, PPE, that equipment and those resources were not available. People were purchasing things. I've seen people wearing dust masks because they didn't know what the right things to wear were. Those community groups that really came together and supported will get that support, because that is the sector that really literally is underfunded, but it turned around and really supported the communities when they needed it. And that's it from me. Thank you very much.
Thank you. I will now like to introduce you to Alexandra Stan, who is a community development worker for Dudley Council, who will share her experiences of the Roma communities and how COVID-19 has impacted this minority group. Over to you, Alexandra.
Hello. I started in January 2020, before we knew how the pandemic would affect people, especially those from BAME backgrounds. My job was to link with Roma communities to offer support to them to help improve their health and well-being. Working with other projects and organizations like Community Project and local church, surgery, library, I would be helping Roma people with getting help from local doctors, housing, work and benefits, as well as sharing health messages about their health and staying as well as possible. This would be more than translating information, but also making sure people understood what they were being told. I do this by sharing the information and then ask them to repeat what they have heard. If they have not, repeat the message and ask them to repeat again until I'm sure they understand. When we realized that communities of people from BAME backgrounds were at greater risk from COVID-19, we knew it would be important to put a greater focus on helping the most vulnerable. The most immediate response was to support people with their basic needs, such as food and other essentials. This would then help to follow the advice on how to stay safe from COVID-19 infection. For example, loss of work meant less income, and many families could not get food or could not they buy soap or hand wash to follow the advice to wash hands more often than normal. That gave me a couple of issues to address quickly. Families were supported to apply for benefits, help with universal credit, difficult because they need documents like payslips, emails, email address for each person, Telephone details can take up to a day, constant reminders, people forgetting to bring documents and having to go home to get them. Links were made with the local food banks and extra support was found to provide fresh food, as this was what the community would normally use to feed their families. As you know, food banks do not normally provide that. Local organization helped to arrange deliveries and families were told when the delivery would be happening by telephone. It was a weekly delivery, but people were asking every day for other things. The risk of being evicted was happening because without money, the rent cannot be paid. I work with housing support to speak to landlords about what arrangements were in place to support them so that families could not be evicted during lockdown. Communication is an ongoing issue. There is the need to translate material for people to understand and post on the community Facebook. The community prefers verbal communication, partly because of low levels of literacy, but also because of wanting to ask questions and have more details. The language barrier was made more difficult when trying to access healthcare. With a few words of English and using hand sign, it may have been possible to get urgent care if you could visit the doctors in person. With the need to use telephone for making appointments to speak over the phone to a doctor or nurse, it was necessary to have an interpreter available. I have supported families to do this when needed. I have taken every opportunity to talk about COVID-19 and the guidance that need to be followed to reduce risk. While visiting families to deliver food or give information on any of above, I have worked with colleagues to make sure that people have properly understood the risk around COVID-19 have to do to reduce their risk. I have spent time with families checking that they have heard the messages and know what to do in practice. It is important when dealing with people under stress for whatever reason to appreciate that their ability to affected. So those who are giving information should take the time to check that what they have said has been heard and understood.
Thank you, Alexandra. You to go back score from positive participation to highlight the needs and the barriers faced.
Hi, thank you. Hi, for anybody who doesn't know me, my name's Gerbax Kaur. I work at Positive Participation, which is an Asian mental health service, which was founded in 2003, and we're based in Wolverhampton. We campaign for BAME, mental health and health inequalities. We currently deliver 2 projects. There's the Asian Elders Dementia Project and the Asian Mental Health Services. Services at the moment during COVID-19 are being delivered mainly online or via telephone. There's no face-to-face contact. During the weekends, we've continued to campaign, particularly now when we've seen a rapid rise in inequalities and racism. During this period of time, we've also continued to chair for community groups and a consortium of BAME groups in Wolverhampton. Now, we've been asked what is the impact that COVID-19 has had in Wolverhampton. So I'm breaking it down into 2 primary areas, community groups and also residents. Firstly, for community groups, we've got to say, hands down, they're all struggling. They've had difficulties purchasing PPE. They're struggling financially. They've got no access to local authority spaces. Many groups said they had not received support from their local authority. And indeed, we discovered recently that the local authority has said that those assets will be closed for the next 6 months. That is going to pose a significant challenge. Many have also shared that they feared that any disclosures that they make would lead to consequences for the group. So if they shared things that they were struggling with either public health or local authority, that those would have a negative impact upon the sustainability of their groups. And they feared repercussions from those because they didn't believe that the trust was there between local authority, public health, and those community groups. Some community groups had also said that they felt misunderstood, because when they say community and voluntary, statutory and health services see community and voluntary as being all under one umbrella. There's a significant proportion of independent third sector community groups, and that is a huge proportion of groups that are lumped in as being all one sector, but they're not. So I think that what we've seen over this period of time is local authority and health saying, who's out there, who can we connect with? Is there actually a roadmap of providers out there? I'm not sure that there is a significant understanding amongst health and local authority of who's out there and what they provide. We've also been told by community groups that resources have been produced in different languages, but they're not accessible to BAME community groups, especially when we consider literacy. Many people from those groups have a limited literacy, so reading those resources is not a reality for many of those groups. There's also a significant reliance, we've been told, upon faith. And I think this is a good thing, because faith is the one thing that's guided myself for many years, and it's a great source of comfort for so many of us. But some faith group leaders, when we visited them recently, had said that some individuals in community actually perceive that their faith is what will protect them. And there was numerous challenges around implementing risk management for them within places of worship, because people felt that they were invincible or that God would protect them, and they were engaging in risk behaviors that were being challenged within places of worship. So this was something that was fed back to us just last week. Some community groups said that they'd struggled significantly financially to sustain their services. They were already the poor cousin of services and heavily relied upon by statutory services as places to go in community, but there's been no thought for how they will survive during these very difficult economic times. They felt disheartened that they'd been asked to engage in feedback and didn't feel that there was any point, because all the reports to them, they believed, just went on shelves and there was no significant changes. And this has been a pattern of behaviour for many years. We are reported, inquired upon, consulted, but what real changes have we seen? Actually, some community groups said that when we have had difficult economic times in community and across local and national areas, is actually specialist services, they're BAME services, because they're not seen as being significantly important. And actually they're so limited, BAME services, people don't know where to go. Where do they find those services? So when they speak about one shoe fits all, actually, does it fit everybody? Or are we just saying that a Eurocentric model is the most important and significant one to fit those people? That to me is an erosion of people's identities, and it's saying that one model fits all. Never, when we consider how ethnically diverse those communities are, that we can say an all-inclusive model will fit everybody. And especially when we break that down into mental health as well. Groups had also said that they were afraid of risk management and feared that disclosures would lead to the groups being shut down or reprimanded, and they didn't feel that they could engage openly and honestly with health and with local authorities and public health. In terms of residents, because we looked at community and residents, BAME communities have identified that they have limited literacy, finances, resources and access to digital technology. This has impacted access to local health and social care systems, which are increasingly becoming virtual. They also identified that mental health has increased amongst BAME communities and indeed all communities. And this remains critical in Wolverhampton, and yet there are no specialist Asian mental health services. We exist, but we're not funded only so far we can do in going mental health on the wards at Penn Hospital is actually Asian people. And yet we don't have a specialist Asian BAME mental health service that is missioned to provide those services. So we provide services with the limited resources that we have and any funding that we can draw in. The other thing that is prevalent amongst residents is isolation, fear, worry. This is particularly prevalent amongst older adults, BAME communities with mental health as well. And yet residents feel that they're left with no services. They really feel isolated at this point in time, and they don't believe that there is any hope because the services are not there to actually support them. I think for us, there are many findings that we have had across the sector, and I think this is a valuable group within which we can share that. But inequalities, racism seems prevalent. People have said, we feel like we're propelled back to the 70s here because there are difficult economic times and we're going to become targets. So I think for those are some of the significant challenges that we have found in Wolverhampton.
Thank you, Gerbax. Thank you, Gerbax. That was really, really interesting. I would now like to introduce you to our next speaker, Pat Johnson from Sandwell African Caribbean Mental Health Foundation, who will talk about the barriers and difficulties within the communities that she supports.
Thanks, Nazima. Morning, everyone. So I'm Pat Johnson. I work for Sandwell African Caribbean Mental Health Foundation, and we are a charity based in West Bromwich, and we deliver a range of services across Sandwell and West Birmingham, mostly for people from a Black, African and Caribbean background with mental health problems, their families and carers. We also work with the wider community. Next slide, please, James. So our current services include outreach support, a user forum, which it's a peer support group, so service users and carers get together to organise their own social activity. We've got a Building Future service which supports ex-offenders with mental health problems and their families. That's us working across the whole of the West Midlands with all of the West Midlands prisons. We've got a Care for You service in Sandwell to support carers. And our Birmingham carer service is for bereaved carers, quite pertinent during the pandemic, is in partnership with other organisations, local organisations who are part of the Communities in Sync consortia. Our most recent service, which we're in the process of setting up now, is a counselling service, which I'll touch on that a bit further on. Next slide, please, James. So we were identified as key workers, and so we needed to revise our operational plan and what we offer and how we delivered the services. So we revised our service offer with all of our funders, which was agreed. We made the building and the offices safe and socially distanced. And then we started working on redesigning the weekly programme, which now includes virtual 11s, peer support groups, Zoom quiz, Zoom exercise. This is supported by making the transition from the community outreach programme to one-to-one sessions for people. And the one-to-one sessions are now via Zoom, which include COVID-19 health and wellbeing checks. So we staff check everybody weekly if they've got any symptoms or if they're concerned that they might have symptoms. We have engaged in delivering food packages, medication, help with shopping, predominantly for people who are shielding. And we are in the process of looking at some digital inclusion work within our own organisation and also more widely within our consortia. So some of the barriers to implementation of the revised services were service users and carers who were a little bit fearful of technology. So we focused on the main areas to get people, to give people the ability to maintain contact really. So we set up email accounts for people and help people to set up their own email accounts. We sort of did a bit of an audit around people with smartphones or don't have smartphones, tablets and laptops. People were supported to download Zoom and other social media platforms like WhatsApp. We had a schemes of work drafted by our office and finance manager, which helped the staff to all give the same information to the service users and carers, so that the information that we gave around their learning around technology and what platforms to use and such like was all the same, and giving people clarity. The impact it's been touched on in some of the previous presentations, but so we agree that there's an impact, disproportionate impact of COVID-19 on the Black community. This has led to increased grief, anxiety and fear within the community. And so we've responded to that in a number of different ways. And the first thing that we did early on was to apply for funding to set up a counselling service, which we're in the process of doing now. This service, actually, we had a counselling service for many years before, but we lost all of our CCG funding last year. So we've been successful with COVID-19 fund from the lottery to reset up the counselling service, which is so needed at the moment within the community, with the increased anxiety within some of the community members. So in addition to that, we've just started to introduce socially distanced outreach visits in the outdoors. How much longer that lasts, given the change now in seasons and colder weather and darker afternoons and evenings, I'm not sure, but we're going to introduce that now, so that people have just got a bit of face-to-face contact. There was still a small service user group who are just not wanting to do Zoom meetings and one-to-ones and things. So we do need to touch base with some people that we've not seen for a while, but probably spoken to on the telephone. We are working in partnership with African Caribbean Community Initiative from Wolverhampton and some other West Midlands Black-led organisations to implement a helpline for the community. Some funding's already been secured. It's not enough. And the fact that some of the COVID-19 response funding is only for 6 months just really serves to underline the lack of understanding there is out there that this can all be, you can set a project up and deliver in 6 months and then everything's fine. I mean, I think some of the problems that communities are facing is going to be a lot longer lasting than 6 months. And lastly, we're going to be working hopefully with the West Bromwich African Caribbean Resource Centre and a wider group of organisations to look at some research to actually have properly documented the experiences of the Black community and how we've responded to and coped with the pandemic. And that's it for me. Thank you.
Thank you, Pat. Thank you, Pat, for sharing your experiences during lockdown, and it was nice to hear how your services have managed to progress. I just want to thank you all for your contributions and your sharing your experiences today. All the data from this event will be collated and transferred into a report that I shall be presenting to the STP. This will be used to make recommendations. I would now like to thank all our presenters here today for their contribution, as well as Shaz Akhtar and James Henderson from TCT. Thanks to my colleagues Paul, Yasser and Fareen. And I would now like to ask Yasser Mahami, the Quality Inclusion Lead, to close the event. Over to you, Yasser.
Thank you very much, Naseema. It's been a great event in terms of the speaking, and what we really have gathered from this event today is the tremendous efforts of the third sector and the innovative ways of engagement and supporting each other. And what we've also noticed is that people are actually reaching out to one another and supporting one another in this difficult time. And what I'd like to say to everybody is to stay connected and look after your mental health well-being. What we'll be doing is following from this webinar, we'll be producing a report as well that will be going to the STP, Strategic Transformational Partnership Mental Health Work Stream, and we'll be also following up this webinar through all the colleagues that partaked in this event today to engage effectively with everybody else that's joined into the call today as well. So what we'll do is we'll make sure that we send everything in terms of the work that we've done so far within the engagement program. I really would like to thank you everybody for tuning in today and listening to our conversation and also being a part of it. And I wish you all the best and take care. Thank you all.
Thank you. Thank you, everybody.